My name is Weil, and I work for Small Business Administration in one of their outreach programs that helps small businesses and startup businesses with their issues and their problems. I've done that for about 8 years. Before that, I had my own marketing services business with Fortune 500 companies, and before that, I was a vice president of marketing for a consumer goods company. I try to get into people's heads and try to understand where they're coming from and what kind of communications and verbiage is needed in order to get them to do something. My grandson likes to say I'm a psychologist to businesses, or a psychiatrist to businesses, whichever you like.
Giuseppe.
I'm Dr. Giuseppe Del Priore, clinical oncologist, but don't make a living doing that anymore. I do research and education, and you talked about the human face, and I have nightmares about the tragedy which we all face, because it's just around the corner, and you're not immune to the horrors at the hands of the healthcare industry that really is beyond the understanding. This children's story is another example.
Never forget, one illness or injury away from financial ruin. Almost all Americans, even with insurance.
Robert Reiss, I host the CEO show. I'm really honored to be here. It was last minute, so that means I had another appointment which I sort of changed. So I'll be leaving shortly, a little after 7. But I really want to hear from Kimberly, and I've been great hearing from what Eve is talking about. I host the CEO show. I also, as an expansion of that, we do a monthly column with Forbes, but I don't work for Forbes. I'm a columnist, just to be clear on that. But I have a passion for healthcare, as you said, Tom Davis, and mental health. I was chairman of the board of Interlude, which was a mental health organization for people who weren't quite there to give them housing and support, and it was because my wife's brother was a client there. And when you see it firsthand, and you put, like Eve does, the human face, it changes everything.
Kimberly, if you could speak a little bit about just your background and your story, as well as GFF and what you've seen working on the ground.
I'm president of the Green Family Foundation, which is a family foundation based in Miami. We, as was said earlier, we work in Haiti, and what we're doing in Haiti now is, or for the last 10 years, is a grassroots, community-based healthcare program, community development program. We work with Dr. Paul Farmer, I'm sure many people are familiar with, and we based our work on his model. Having said that, there's a lot of things I think that we can learn as Americans from the healthcare in a country like Haiti that's being applied down there that is not working here in America, that I really think we should take a lesson from. And we can talk about that later. We talked earlier about direct observed therapy and being a part of one-on-one treatment for people. At the same time, our foundation, we just started a program in Miami with Florida International University, opened a medical school. It's the second one in South Florida, second medical school. And our involvement was to provide them with financial assistance to include social medicine as part of their curriculum, not only as an elective, but as a required part of their curriculum. So every young student that signs up to enter medical school becomes part of a medicine and society program. They're assigned a family in an underserved community in Miami, in Dade County, that is living in a poor resource community, identified through a local CBO, and they follow this family for 4 years. They work with them on everything from cleaning their air filters to might be causing bronchial issues for their children, to what they're feeding their children, to what type of alternative foods rather than fast foods, all things that affect the healthcare and psychological healthcare of the community. We like to say it's the first in the country, but I really don't think it is. But it's the first required in the country, as opposed to being an elective for most universities. And on a personal level, myself, I'm also speaking as a patient. I'm a person living with stage 4 cancer. It's a chronic condition for me now. I'm 3 years into my treatment, into my recovery or survival, whatever you want to call it. And I'm on on treatment every month, and I've been fortunate enough to have good health insurance, which in the long run really isn't that good when you have a long run. And I'm fortunate enough to come from a family that is able to help support me in all this. And alternative, you're talking about art therapy, doing acupuncture or art therapy, or all these other things that can sort of help you in addition to the chemotherapy and radiation and whatever you take, with diabetes. So I've been fortunate enough to take advantage of that, but it's been, in my experience, something that should be provided to everybody and not just someone who has the ability to afford it. So even I met through MWW, and we've been chatting about this, and we talked about how maybe this could be something. I wish that we had another person here who was in my same condition, who didn't have the resources that I have to maybe counterbalance that, but I think we hear about that a lot. So we can draw upon what we've read of people like that, and maybe you can help us
Well,
put
with
a
a
face
dozen
on
of them
that.
every day. I had to admit a patient of mine to the ER on Friday night, so I could transfer her to Memorial. She's there today, because her insurance, she has no GYN oncologist available to her anywhere in their network, and they keep trying to give her bullshit about that this is a GYN oncologist, and they're not, of course. And I'm going to unfortunately have to do the same, get another subject